So hello, Caroline, and hello, audience. We are particularly kind of honored to have Caroline Roan with us here at Columbia. As was stated earlier, she is a Columbia person. She got her master's degree in public policy from SEPA in 2000. And is now the Vice President of Corporate Social Responsibility at Pfizer and also the President of the Pfizer Foundation. So Pfizer, many of you know, is based here in New York City. It's a leading global pharmaceutical company founded in 1849. Its reach is vast with sales spanning 125 countries and 90,000 employees around the world. Pfizer's products range from common household brands like Advil, Chapstick, Centrum, Preparation H, Robitussin, to prescription drugs that include Lipitor, which treats high cholesterol, Diflucan, an antifungal, Prevnar 13, a pneumococcal vaccine, Lyrica for pain, and of course, there's Viagra. From the very outset, Pfizer has championed corporate social responsibility as a defining part of the company. And today, Ms. Roan is charged with realizing Pfizer's corporate social responsibility strategy, which seeks to broaden access to medicines and strengthen healthcare delivery for underserved people around the world. As an ambassador to this conference from the Mailman School of Public Health, I am personally interested in learning more about how corporations can, should, and do the work of improving access to pharmaceutical products, knowing very well that the socioeconomically disadvantaged groups that are negatively impacted by high cost and inaccessible treatment to address various health conditions is a pressing issue. And indeed, this is an issue without controversy. Pharmaceutical companies are very much vilified. However, as you'll hear today, Caroline has been, who has been named the CR Superstar by Corporate Responsibility magazine, will tell us about her day-to-day, how her day-to-day work helps to reconcile some of these challenges and how her days at Columbia helped to prepare her for this very important role. I just want to take the moderator's prerogative to let you know that we are taking questions, but we are only taking questions from the app. And so if you haven't already downloaded the app, please do so. We will leave some time for questions at the end. So this is a fireside chat. It's really intended to be a conversation. And so with that, we'll start with an open question. Like, tell us about how you got here.
Sure. Well, first of all, I want to say thank you for having me. It's always great to be back at Columbia. I said I felt particularly old when I think about the fact that it feels like yesterday that I was at SEPA, and it has been a while. I got to Pfizer not in a direct path, and we were sort of chatting before the start of this conversation about how students at Columbia usually have a plan, and they may have that plan starting at age 1. And so I didn't have a clearly defined plan. I was a liberal arts undergrad, didn't really know what I wanted to do, but was very passionate about healthcare because healthcare had affected my family's life directly. And I had this sense that perhaps I didn't have the scientific prowess or expertise to be a physician, and so I wanted to find my path. And I ended up at Brandeis University working in behavioral health research. Then got a job at Yale where I worked and focused on HIV and specifically on injecting drug use. And then from there came to SEPA. And one of the things I loved about SEPA was that it allowed me to have truly an interdisciplinary approach to what I wanted to do, and they let me take classes among all the great schools that Columbia offers, and I think that was really pivotal. And at that time, I really thought very carefully about the role of philanthropy and didn't really know about corporate philanthropy, but had obviously written grants for professors like you and understood the power that philanthropy had to both change the world, but also to really test models for how public policy could be formed. So I went to the Robert Wood Johnson Foundation, and then I sought out a position at Pfizer.
So are there any kind of personal motivations for doing work in health?
So for me, the personal motivation was that as a teenager, I lost both my parents in rather short succession. And I saw, as a family that was well-equipped, how devastating that was. And I did not want anybody else to experience what I felt as a young teenager trying to navigate care for my parents. And it was deeply personal to me, and I wanted to find a way to reach and think about people who had less resources than I did and what that experience might be like. And so that really charted my path. And as I said, I would have loved to have been a physician, because I think there's no more noble physician or nurse or direct care provider. But unfortunately, I didn't have quite the skills necessary to do that, so I found my path to hopefully achieving some of those goals.
So clearly you do have skills, really amazing skills that are used on a day-to-day basis. Can you tell us a little bit about what you do with the Pfizer Foundation and the corporate social responsibility program?
And I know for many of you, you may think corporate social responsibility, sustainability, sometimes you can really get caught up in the words. So I try to boil it down very simply, and at Pfizer, it's the how of how we do business. And why is that the case? Because our core business mission is actually the same as our social mission, right? We discover, develop, and bring to market medicines and vaccines that help people live longer and healthier lives. And with that comes a set of responsibilities to do our part to ensure that those medicines and vaccines are accessible, and that there is a well-functioning healthcare system with quality healthcare providers, diagnostics, and ability to provide the care that patients around the world need. So my day-to-day is focused primarily on developing programs that really use the full assets of the company. Our people, our medicines and our vaccines, but also our grant-making dollars, which we, in the theme of this conference, think of as real capital. Like, how do we deploy that capital efficiently and effectively to help those communities?
So tell me a little bit about specific programs and initiatives that are happening under your care.
Sure. Well, I'll start with one which I think is a really interesting model and more traditional, which is a donation-based program. It's the International Trachoma Initiative. Some of you may have heard about that. Trachoma is a neglected tropical disease. You don't know about it because you live in the United States of America. You have access to clean water in most communities, I should say. And it isn't something you have to worry about on a day-to-day level. But what happens is that it's an infection of the eye, and it kind of looks like pink eye, you might think, with some discharge. And it's spread very easily in communities without access to clean water and sanitation. And over time, the eyelids turn in and they scratch your cornea. And it's really incredibly painful, and eventually it leads to blindness. And what's really interesting about the disease and Pfizer's role there, for more than 20 years, we've been working in the space to eliminate this disease, because we can eliminate the disease. And we discovered back in the late 1990s that Pfizer's antibiotic Zithromax, which some of you may be familiar with, was effective in treating the active infection that causes the disease. But we knew that it would take more than just our medicine to achieve the goal, right? And so we partnered with the World Health Organization, and they launched a comprehensive public health strategy called SAFE. Surgery for advanced cases where the eyelids have already turned in, that can be done very easily. The antibiotic, which is our Zithromax, which treats active infection, and you can dose once a year, and it will treat the infection through what's called mass drug administration. And then we have face washing and teaching kids about the importance of washing their hands and their faces. And then environmental development, so that people have access to sanitation and clean water. And today, we have more than 100 partners working in 17 countries toward the global goal of elimination by the year 2020. We've achieved elimination in 6 countries. And what I like to say about this program is that people will say, well, that's just donation, is that sustainable? And what's fascinating about the program is that it's been built on innovation, right? Because Zithromax was truly a game changer in this neglected tropical disease. Because before Zithromax came along, the standard of care was antibiotic ointment. And I always joke about this because I can't make my children put anything on their eyes or take any of their medicines. And imagine trying to do that in a setting without clean water multiple times a day. Now, Zithromax enters the picture, we do the confirmatory studies, and we identify the fact that it can treat that active infection through that one dose. Game changing. That set the course for elimination. But it's not easy, as you know, from public health to achieve those goals. The second game changer for us was using technology through an app that some of our partners conducted a household survey, and they literally went household to household to determine where trachoma still resides in the world. And that information, at the time, it was the largest global mapping project that we had done, allowed us to more effectively distribute not only our antibiotic, but more importantly, the full safe strategy. And that's what's going to get us toward elimination. So we've got our eyes on that prize, and we hope to achieve it. And that would be actually a huge accomplishment, because 163 million people still are at risk for that. And you know the downside of the economic downturn if you go blind from not being able to care for your family.
Of course, so the importance of this issue is absolutely apparent. How do you measure impact?
So for us, in the context of, that's a really great question, isn't it? So we do it program by program. So within where we focus and how we focus, we do evaluations of all of our programs. With trachoma, we have the World Health Organization, who certifies countries as actually free from the disease. For some of our other programs, we seek to understand what we want to accomplish, and then we usually work with an academic partner to do some level of evaluation. And I'm always careful when we talk about measuring impact, because there's measuring impact in the context of an academic study, and then there's measuring impact for how many patients we actually reach and what we believe the impact is. And so we do a lot of traditional measurement of outputs, but we also look at the social determinants of health in the context of what we do. But it is program by program.
Wonderful. So that's one example of a donations-based program.
Mm-hmm.
What are some of the other programs in the portfolio?
Sure. So one, just to sort of lead from our concept of full assets, right, our products, vaccines. Now, we have heard from some of our stakeholders that they don't think that donation is sustainable, that they want more creative commercial strategies to reach populations that are falling through the cracks and not getting the medicines and vaccines they need. So one example of a creative strategy is Gavi, which is the Vaccine Alliance. Some of you in public health may know about Gavi's fantastic work. Pfizer made a commitment to provide our pneumococcal vaccine, which is Prevnar 13, to Gavi, and it is now 1 out of every 2 doses that Pfizer distributes in the world goes to Gavi-eligible countries. That's been a significant commitment for us, and it is at the lowest global price, which is under $3 a dose. And for us, what is very special is that within the context of what we've been able to do with Gavi, we've probably protected 29 million or so babies from pneumococcal disease, which has been significant. But we've also made a forward-looking commitment to Gavi to provide that vaccine. We've committed to more than 930 million doses through 2027. And what's great about Gavi is that it is funded by multilateral and bilateral organizations, but it requires government participation. So governments have to demonstrate that they have the capacity to take in all the vaccines, not just our vaccine, but a number that will help keep babies safe, and that they have the capacity to distribute those. And we also work on the distribution of vaccines overall, not just for Prevnar specifically. So that's an example of a creative strategy around our products.
Mm-hmm. Are there any others that you're particularly proud of?
So the other thing that we like to think about is how to more effectively use our cash, our capital. And this is, of course, the theme of the conference today, and it's something that we're very proud about. You know, the Pfizer Foundation has been in existence since the 50s, and we had never done anything in impact investing. And so several years ago, we started thinking, look, it's been fantastic to work with kind of the blue chip international NGOs. They do great work for us. They have scale, they have scope and capacity. But innovation is happening at the local level. And we felt like we were really missing that. And these were entrepreneurs who have big ideas. Some want to be social enterprises, some want to be traditional NGOs, some want to be a for-profit company. How can we really use our capital to effectively help support them, test those models, and take those to scale? And we do that in 2 ways. One, we do investments through investment funds. One of them for impact investing that we do is the Global Health Investment Fund, which was launched with JP Morgan and the Bill and Melinda Gates Foundation. That's very specific, taking late-stage assets, including diagnostics, over the line for use in low-income countries. But we saw, in the context of our work to understand the impact investing landscape, that catalytic grant funding was really, really critical. I know you know this from your research, but that in many cases, the entrepreneurs either were on the cusp of getting too much capital before they were ready from an absorptive capacity, or they had very specific needs that the funding community wasn't flexible enough to provide. So they weren't investment ready, but they might need capital to build their model or test or try new sort of approaches to reaching the population that they were looking for. So we have now funded 20 organizations through a global health innovation grants portfolio. Super cool entrepreneurs doing amazing work on the ground, and we can talk a little bit more about that. But we're very proud of that because, as I like to say, it's not your daddy's philanthropy. We try to sort of modernize the concept of how we were working in true partnership and learning from them and being flexible enough to meet their needs.
That's all really inspiring. So how does the kind of Pfizer approach to corporate social responsibility initiatives and the foundation kind of structure its investments? How do you decide essentially on kind of investment-worthy initiatives? And how do you balance your business mission with your responsibility to patients and global health?
So sort of back to how we balance that, we work hard to do the right thing and to try to see where that unmet need is. And I always say, you know, we have therapeutic areas of focus for Pfizer that are specific to our core business, and it makes sense for us to lean into those areas, right? Because we know those areas, we have expertise inside the company, and we can deploy that to meet those needs. So that is the first lens with which we look. And then we overlay that against unmet need, and we try to figure out approaches to address that, very specific to the issue areas. So we work in integrated family planning and vaccine delivery because we know something about both. And we also want to move the field of global public health and look at ways to do things a little bit differently. And you know this, you tend to have a sort of siloed approach to achieving progress in a disease that is is not how the patient actually experiences both healthcare and presents. So we try to think about the bigger systemic issues and make that come together through our programmatic work.
And can you provide examples of where you've had kind of the success in providing patients and communities access to healthcare and medicine?
So I think from our perspective, the work with the International Trachoma Initiative is a big one for us, and we are incredibly proud of that, and also incredibly proud of the fact that we've been in it to win it for longer than 2 decades, which I think is something that perhaps might be unexpected for some of you in the audience. Gavi, another example, we're continuing to push ourselves to think about those creative commercial strategies, and we most recently announced a program with the Clinton Health Access Initiative as well as the American Cancer Society on a set of chemotherapy agents that are needed in East Africa and making those available at a deeply discounted price for use in public hospitals. So when you say, like, how do we know what we need to do? We have a big presence commercially in oncology. We heard very clearly from patient advocates and from providers that there was an unmet need there. And then we sought out partnerships with the right organizations to bring that forward.
And obviously the Trachoma Initiative is a really large-scale project. And as someone in public health, we don't often think about corporations as kind of partners, but obviously something like this requires a lot of partners. Can you tell me a little bit more about the partners that have been involved, not only in the Trachoma Initiative, but in other initiatives that have made the work more fruitful, but also kind of more impactful?
Sure. So I think through the Global Health Innovation Grants Program, that's where I would say that cohort of about 20 entrepreneurs has been really amazing to work with. And I think, from our perspective, what's interesting about that program is that we had to bend and flex a little bit more than we had traditionally done. And I'll give you an example. There is one of our entrepreneurs named Javier who is trying to launch a series of clinics in Mexico that are focused solely on eye care. And it is a for-profit model, and he wasn't investment ready. He was really struggling to get the right technology in place, the sort of infrastructure elements to scale his clinics. And our grant funding came to him, and we allowed him to do what he needed to do with it. And as I said, we typically are very prescribed in that, right? As a funder, you want to know exactly what you're going to achieve and how you're going to achieve it. You got to send us a ton of reports. And in this case, it was a very personal dialogue with him about, and his leadership team, about what they felt they needed. Now, this is a former finance guy, so he was very well equipped with a language and an ability to sort of communicate with us. And then when looking at his business proposal and how he had been working at the clinic level and some of the challenges they faced, he said he really needed help with recruitment. And so instead of just bringing cash to the table or our capital, we decided to deploy a team of Pfizer colleagues. And we loan our people out to work with our partners, and this has been going on for more than a decade as well, both through individual assignments but also through teams. IBM is a corporation who's done great work with teams, and we've really copied that. But we put a team together that was from all over the world, actually. They met in Mexico. They worked for about 4 weeks with Javier and his leadership team, and they developed a comprehensive approach to recruitment of healthcare providers and retention. Because for him, he said he can't take his model to scale unless he gets more providers that are adequately trained and that he can keep them, because they're working with populations that are struggling with a lot of issues, and it's not easy. And he needed and felt, his leadership team felt, they needed a way to really shore them up and make sure they were equipped to sort of take forward that mission-driven work. And from our perspective, if you were to talk to him, he would say that might be even more impactful, the work of that team, than perhaps the capital that we've given him.
And I imagine, so I do a lot of field-based work and a lot of community-based work, and there are ways in which I understand not only need, but when things go well, there's something about that kind of personal experience in the field that's just like, wow, this is important. Have you ever had one of those moments where you just are kind of traveling around identifying either projects or kind of following up on them, and you decide, and you feel like, wow, this is right and it's important?
Well, so for me, I think I have the best job at Pfizer, and I say that all the time because I get to experience that more readily than you might think in my corporate role, and I actually am very deliberate about that. And that may be the sociologist or the anthropologist in me. But I do have one particular story where I don't know how many of you have had the opportunity to travel to Senegal or to Tambacounda, which is an area of the country which is very endemic with malaria. But it's also very hard to get to. And we had traveled for some time and little planes, and then, you know, in a very long and hot drive. And we arrived at this village, and, you know, the graciousness with which people greet you and welcome you to their communities is quite something. And I think it's fundamentally because you can find something that you share, which is a deep commitment to wanting to make sure that your community is healthy. And that's what they had. And I was really hot, and it had been a long journey. And they had a moment of prayer for the team that had come from Pfizer and our partner organization. And I was so moved by that because you know, this woman said basically through translation, you know, I pray for you and I pray for the team because it's made such a difference in our community. And this was a community that really lacked very basic services, and we had built health huts to try to do screening and awareness around malaria. So those moments happen, and they're moments of real privilege, and I'm grateful for them, and I really carry them with me.
It's the motivation, right?
Yeah.
That's the kind of
Yeah.
the thing that fuels further work. Now, I want to ask about scale, because obviously project by project or program by program, part of the problem is how do we get Javier's model, for example, to scale? And he identified kind of locally some challenges, but I imagine that, you know, there are programs that would translate very well in other kind of contexts around the world. How do you kind of consider that? Like, what are some of the questions or approaches that you use to address the scale issue?
It's a great question, and scale is a relative thing, right? So I would say that through coordinated efforts like the work that the industry, not just Pfizer, does in neglected tropical diseases, which has required multilateral organizations to sort of focus and lift that up, that has allowed us to get to scale, as well as the Gates Foundation, which has been, as you know, a transformative player in global health. And from scale for Pfizer, if you think about our global footprint, for Zithromax, more than half of our commercial product is donated to support that program. So we reach roughly 110 million people through that program every year. So that's real scale. On the entrepreneurship side, I think we struggle with that because we haven't figured out a masterful way to take Javier's eye care model in Mexico and have it apply directly in India. There have been some really interesting programs in India as well. And what we're depending on and try to work with are thought leaders and academic organizations who have more of that expertise, and they can sort of help guide us. And we work with Duke, for example, in their accelerator program on entrepreneurship, and that's been an area where we've been able to depend on them to help us know how to be better funders in that way. We don't have the full answers to it, but that's what we're seeking to do. And we're also seeking to be honest about what works and doesn't work. So we've published on our work with entrepreneurs. We've published on our work on integrating services, which again is kind of a new area. And we do that trying to be transparent about the challenges we've had in thinking about scale and where we go from scale. But I was on a panel a couple weeks ago around the SDGs, and we were talking about the issue of scale, and I said one basic thing in global public health, which I'm sure you agree with, is people had access to clean water. We would be solving a lot of issues, and that would be scale.
The fundamental causes, right?
Right.
In some ways always appear. So obviously this is a conference on entrepreneurship. And I wonder if you have any ideas about how do people kind of prepare to be an entrepreneur that is supported by Pfizer in whatever kind of for the kind of work that you're supporting. How do especially the students here get there? How do they become kind of effective entrepreneurs that are fundable?
Well, so I would say a couple things. One, I'm a big believer, and probably because I'm in the business of health, of an interdisciplinary approach to your work. So I definitely think entrepreneurs that have a sort of 360 or a holistic view of the issue they're trying to solve and are able to at least navigate and discuss that with a level of understanding of how those might be barriers or opportunities for the work that you're taking on is really beneficial and helpful. You also have to be able to translate, right? And I call it cultural fluidity, which is more about the fact that sometimes sheer passion isn't going to get you funded when you do a case, right? So you do have to know your audience. And if you're going to pitch to Pfizer, it would be helpful to kind of know what the goal is and how you seek to get there. But we've also recognized that through partner organizations that we can help support kind of understanding your audience and how you do your pitch. And it's very basic, and you all learn this all the time probably in your work here at Columbia, but it is important. And the third piece that I think is a little less obvious, but something that I really focus on the personal level, is urgency. I love entrepreneurs who move with a sense of urgency. And I think you might say that's inherent to being an entrepreneur, but it doesn't always come across. And I think when you've got that marriage of like, I am on a mission and I'm going to achieve this, that's really inspiring. And it also gives confidence from a funding perspective that you're going to work hard to do what you need to do to get that model to work for you.
So be urgent. Be urgent in your missions. So the healthcare industry is one of the least popular business sectors in the country, and you're really doing amazing charitable work. How do you kind of reconcile the tension between how vilified the pharmaceutical industry is in particular and the kind of amazing, impactful work that you're doing?
So that is the million-dollar question, but I take it from two perspectives, and maybe I'll answer it based on these two perspectives. One is just the research of reputation. And then two is more on the human element side of it. So from a reputation perspective, we've looked at this, right? Because for us, especially when we're proud of the work we do and we're proud of our scientists, we really struggle with why people don't like us so much. And what we do understand to be true is that for the general public, particularly in the United States, they don't differentiate among the pharmaceutical companies. So they think of us sort of collectively, you know, and some of you may call us this, big pharma, and it's sort of like if one company does one thing bad, we all feel the effects. If one company does something good, we can also all benefit from that, but we move in a group. So it's been very hard to break that out, break through the noise and sort of tell the story of different companies and their commitments and understanding of how they balance societal expectation and their business model. My personal opinion is it's on a human level. So there are very few things as important to living a dignified life as access to quality health care. It's what unites us. I've been a patient, you've been a patient, somebody we love is a patient. And therein lies a lot of expectations for us as a pharmaceutical industry, for physicians, for hospitals, for insurance companies. And the expectations that society have about that are so high because I think it's so personal. And I think that's good because that sets the bar for all of us working in the healthcare industry to try to do better and to think and put those patients first. And I think for Pfizer, we want to tell the story of that commitment and do our best to achieve those high expectations. But there is a tension.
So what do you think distinguishes Pfizer?
So I think a couple of things. One, whether you think about it or not, because we are a big company and you know people laughed when you said Viagra, we're known for that product. I mean, I think if there's one thing that I asked all of you about, you might know that. And what I would ask you to sort of reflect on is how we think about the patient and the people who are at the company. Because people, the people at Pfizer are really special. I mean, they're really committed people. They're really kind people. And they really want to develop those cures. And they're working every day to do that. And so for us, I think that's a distinct difference than you'll see in other companies. And the other component, I think, is the historical nature of the company. I mean, you touched on it. It was founded in Brooklyn in the 1800s by two immigrant cousins from Germany. And one was a candy maker, one was a chemist. But they actually started doing work for immigrant communities when they founded the company. So that sort of ethos has transitioned over the years from CEO to CEO to CEO. And that's why the Pfizer Foundation was established. We've continued to endow it. That's why when we made the commitment 20 years ago, many CEOs ago, to Trachoma, we've kept it. So I think that's really unique and different about Pfizer, and I'm really proud of it.
Wonderful. I think we are ready for questions. Thank you for those of you who have submitted questions on the app. We do have a few questions that came through earlier, and I'll just start there before. No, it's, oh, do you want me to?
Yeah, I'm going to ask the questions.
Great. Okay, great. Well, then you go.
Okay. So the first question is, what are the civic responsibilities and opportunities for individuals not in the healthcare sector who want to help improve access to health and wellness?
So great question. You know, I always, as a funder, having worked at Robert Johnson, you know, people say we don't fund education, we only fund health. Okay, so like it all goes together, right? So I would say the first and foremost is get involved in your community because you can understand what those issues are at a very local level, and then you can make a distinct difference, whether that's in transporting people who need care, advocating for clean water, know the issues locally. And then get to know your leadership. So you need to know who your local representatives are, federal, state, and most importantly, you need to vote on those issues. And that, from my perspective, is the way that if you're not going to pursue healthcare, great, but it does matter to your local community, so get engaged in those issues where you can make a difference and then vote.
Great. Next, we have a question from Colby at the Yukon Foundation. And the question is, how do you recommend someone working in the nonprofit sector doing frontline fundraising and grant writing to make the jump into CSR?
Well, I see a lot of people who want to do that. So a couple of things. I tend to say if you've only done fundraising, I would really strongly recommend that you shift to programmatic work because the way that I think I was hired, and we were joking about this at Pfizer, I was not a typical applicant because having worked with injecting drug users and, as a sociologist, anthropologist, I'm not sure I would have been top on their recruitment at the time. But I think what was valuable for them and what they saw in me was my expertise in HIV. So I would really recommend that you try to shift and get some programmatic expertise and then leverage that back in to what the company's focus areas are and bring that forward, whether that's energy, whether that's the environment. But that sort of in-country experience is invaluable. And sometimes I think when you only service the fundraising component, you miss the opportunity to build that expertise.
Great. Our next question is from John, and he wants to know, what are some global health issues that you would like to see Pfizer and or other pharmaceutical companies help solve or contribute to, whether that be in a for-profit or charitable way?
So ideally, we would be all working toward the global burden of disease, which we know well. And I think of it in two ways. We've got this dual burden of infectious disease, but also non-communicable disease. And it's really converging in global public health and putting strains on government's ability to provide resources, particularly in low-income settings. And so we've got to do our part to address both. And I think we've done relatively well in gaining traction on the infectious disease front, maybe a little bit less so from a multilateral perspective on the epidemic of non-communicable diseases that is sort of affecting some of these countries.
And we'll kind of wrap this up. Do we have one more question? Okay.
It seems like version 1 corporate CSR initiatives tend to flow from business priorities as much smaller and ancillary impact opportunities. Have you found instances where the programmatic CSR work originates and drives new business opportunities? And how do you balance that tension?
So my perspective as a CSR professional is you got to be joined up with your business, or otherwise you will be tangential. And so I always say, I know exactly what drives our business. I am deeply connected to the commercial organization. It's in my best interest to understand those priorities and then to determine how we can co-create programs that will meet the needs of the patients and the stakeholders that we serve. And so a perfect example for Pfizer is that for me, I've really pushed the company to think more about these creative commercial strategies, not just the donation model. And I think you're seeing that take place with a number of our peer companies who've done it quite well. And I think you have to know the language and know the sort of company culture and push to drive that synergy, because I think in today's world, people expect, all of you as young folks starting your career, expect companies to drive social impact. And I think we're seeing that across the board, and it's our job as CSR professionals to make sure that you're not sort of a sideline and that you're really a core, thoughtful business leader bringing those solutions to bear.
We've got one more.
Okay.
Regarding your comment on sense of urgency, what advice would you give healthcare-focused startups when dealing with established companies, given the average sales cycles of 18 to 36 months?
Well, that's a great question. So I would say, first of all, be prepared. I mean, it is amazing to me that some folks with urgency will move maybe a little bit too quickly before they have thought through, is this the right company for possible partnership? Done their proper research, built their sort of pitch documents so that you can make a great first impression. And I think you just have to balance that. And one of the things we try to do in our group is to help folks navigate Pfizer, because Pfizer, as you said, is a big company. And if you've got an idea, sometimes it's hard to find the right place within Pfizer because we have our venture group, we have our BD folks, we have our work. So we do try to help provide that navigation, and I would strongly encourage folks to do enough research to understand where that navigation point might be for you and the company that you're seeking to pitch to and to partner with.
And just to kind of wrap this up, I always like to be kind of future oriented, so I start the interviews with kind of understanding where you're coming from. But what's next? So what's next for Pfizer in terms of corporate social responsibility? What are the kind of budding ideas that you're toying with at this point? What's next?
Well, you know, from my perspective, one of the things that I value on my team is curiosity. And so I think what we're trying to push ourselves to do is to think bigger about scale, because we have scale. And how can we use that scale to really drive the kind of impact that we need to see at the global health level? And as I said, we don't have those answers yet, but that's what we're thinking about. And we're also trying to think outside the box, because, you know, as a company that, you know, was founded hundreds of years ago, it is sometimes easy to become a little bit complacent. And so I think we've infused our company culture with that sense of urgency to try to think differently about how technology can help us drive that scale. And that's what I'm excited about. And so hopefully you'll see some new ideas coming from Pfizer in short order on that.
Well, I hope that you will all join me in thanking Caroline Roan for a wonderful lunchtime keynote.